So welcome back to our Pink Couch series. I'm Megan.
And I'm Dr. Cox.
And today we're going to talk about when to check your fertility, because you've probably seen on Facebook and Instagram all of these ads for different ways to test your fertility, and we just want to give some insight on what that entails.
Yeah, I think it's really important, especially young women in the 20s and 30s. There's lots of ads out there these days on different social media platforms that are talking about checking your fertility or doing at-home fertility tests, and it can be a little overwhelming and consuming to people that don't really know what that means. So the good news is they're talking about it, right?
Right,
it's getting out
because
there.
we want to just get, the word out there, because fertility can be such a hush-hush topic for some people, So,
yeah, and a lot of women think that, as long as they're healthy and in shape, like time may not be of the essence until you get closer to your 40s, but that's not actually true for many women out there. So it is important to understand what checking your fertility means and kind of what it entails.
Right. Some people are just like, well, it'll just happen when it happens. But sometimes there are things that, you need to get fixed. And
it's true. So what does checking your fertility entail? For females, it's mainly looking at egg reserve, and it's important to understand kind of what egg reserve means. So females, unfortunately or fortunately, depending how you look at it, we were born with as many eggs as we're ever gonna have, and by the time we hit puberty, we're down to even less than half of those eggs that could be used to help us get pregnant. Whereas men, they make their sperm until they're 50, 60, or if you're David Letterman, you can have kids at 70. So men have a lot more efficient system in some ways of being able to get someone pregnant. Females, however, are on a time clock. It's important to realize that so that we can take our health in our own hands. Ultimately, because we have lost so many eggs by the time we hit puberty, there's different hormonal changes that shift when we lose eggs over time, and that at-home kit that people are looking at through Facebook, Instagram, or even if you just go to your primary care doctor and say, hey, I want to check my fertility, the main thing most people think about is just those hormones. They check hormones to see how the brain is stimulating the ovary to see if it's normal or if it's having to work really hard because the ovary's aged. And it also checks another hormone called AMH, or anti-Mullerian hormone, that is made from the nest of cells that surround the egg pool we have left. As that egg pool goes down, AMH goes down, and it suggests that we're running out of eggs, or our egg quality may be affected.
yeah, so what about all those folks out there that are hormonal birth control? Like, how would that affect the hormonal access when you're getting your fertility checked?
Yeah, so the main hormone that you can check when you're on birth control is just AMH, because we found that AMH, or anti-Mullerian hormone, doesn't change during the menstrual cycle, nor is it really affected by birth control that we have seen so far. However, that hormone that I talked about that can be checked, that's the brain stimulating the ovary, it's called FSH, and that actually can be suppressed when people are on birth control, so it can actually be falsely lowered. And that's important for women to know, because those at-home kits will check for all of these things, and if they have a low AMH but they also have suppressed FSH, it may be because they're on birth control, like oral contraceptive pills, which can affect that level.
Right, so how far in advance would they need to be off of birth control before getting this checked?
So it just depends. You can just get your AMH checked, and an AMH is a good reserve. We've been studying it for probably 10 plus years now, and we think that it's pretty solid in the sense of telling us how many eggs are left. So you don't have to get off your birth control to get just that value checked. But if you really want a thorough access check, which is the FSH, estrogen, and AMH, you should be off birth control for about 1 to 2 months before you get it checked, because it'll give you a really accurate number at that point.
Gotcha. I think that's really important for people to know, just so that they don't, get these tests when they're on birth control, because their results could be a little bit skewed.
Right. I mean, certainly the one hormone can be skewed, and it can kind of falsely give you reassurance, which can be a little scary for some women. The other important thing is, though, so, we talk about egg reserve, and egg reserve is just looking at the eggs we have left, which obviously is very important for females, because if you have no eggs left, you cannot yourself get pregnant. You might have to use eggs from someone else, and that's a whole nother topic. But ultimately, there's other things that go into fertility checks as well. So most important, yes, do I have eggs left that I can use at some point in the future to get pregnant? But there's other factors that come into play for fertility checks.
Right, like tubal factors, uterine factors. You can have congenital issues with your anatomy that, can't really be checked by getting your blood work done.
Correct. The blood work only gives you the eggs. And the rest of the evaluation checks to see, hey, is the tubes open for sperm to get to those eggs? Are there uterine factors that could affect the sperm getting to the eggs? All of those come into play. And then of course, don't forget the men. I mean, they have to make their own sperm. So not everyone is created equal and some don't make as much as others. So it's something that, male factor wise could be an issue too in the future. So just because females check their hormones and they're normal doesn't mean that they're gonna have an easy time getting pregnant in the future. It just gives us one point in time to say, hey, your egg pool currently looks okay, or it looks like it's already declining.
Right, and so it tells you at one particular point in time, but it doesn't necessarily project in the future how long it will stay good.
Correct. Yep.
So is this something that people need to be doing every year or every 6 months or just one and done? Like how often and how, like at what age when should they?
The truth is it's a personal decision to when to get your fertility checked. Ultimately though, we know, being a fertility specialist, you know that at the age 35 to 37, most women's egg reserve starts to go down pretty quickly and kind of a more steep downhill climb. And by the age of 40, really, I kind of describe it as jumping off a cliff. There's women over 40 that still have some good fertility, but a good majority of women don't. Ultimately, I generally recommend that if you are the age coming into age 35 and you don't have a prospect of wanting to have a kid anytime in the near future, don't have, a set relationship where you're looking at that, or you know that you're going to be putting off childbearing for even a longer period of time for career or just personal reasons, I think it's important by age 35 to at least get kind of a checkout to say, hey, where am I at in this scheme of things? The downside of that is that just because we do it once at age 35 doesn't mean at age 36 or 37 it's going to be the same. So it only really gives you one point in time, theoretically. While it doesn't have a set age cutoff to be checking it, ultimately there's certain factors that can make you say, hey, maybe I need to get this checked sooner than age 35. And those factors can be if you've had irregular menstrual cycles throughout your lifetime and you've been put on birth control because you're not getting cycles regularly, or you go from having cycles to not having cycles, that can be kind of concerning as well. And I would recommend getting checked up. And other things that can fall into place, are like autoimmune diseases or thyroid diseases or things like that, because they kind of go hand in hand with affecting fertility.
Other disorders that can affect the hormonal axis.
Right, the hormonal axis or egg reserve.
Or egg reserve.
Yeah, exactly. So those are all things that can make a woman consider doing fertility checks sooner than at the age 35. But certainly by age 35, again, if you're not really ready, I would recommend it because we've seen so many women between the ages of 35 and 40 where their fertility is significantly declined, and how many of them have come in and said, gosh, I wish I knew I could have checked this sooner. Right.
Yeah.
Exactly.
So say they get it done and it's considered low, what would be something that they could look into for?
Yeah, so that's going to be our next podcast, really talking about fertility preservation. But ultimately, if you have a lower reserve, that tells you that if you want, you can look into trying to do fertility preservation options. And we'll get to that, like I said, in our next podcast. But the whole point of this testing is to really give women the power to kind of take their health in their own hands and have some more control over it. Because the truth is, since we are on a time clock, it puts a lot of pressure on us as females to have a kid at a certain age or have to get in a relationship by a certain age to be able to have a kid. And by knowing there's
that relationship,
it puts the pressure on a lot of people involved. So there's a lot of pressure out there. So the whole point is that having access to this testing, understanding what it means, and then understanding what you can do with it really empowers women to be able to not have to stress and have that pressure on them, in their 30s.
It gives you a peace of mind for the future of your eggs.
That's right. So I definitely recommend it, especially when, we're getting into the 30s. And I want everyone to listen out for our next podcast where we talk about fertility preservation, basically what can you do
and what the process is like.
Yeah, all of that. So
all that to look forward to.